We will continue where we left in the previous part. Praziquantel is a drug of choice in schistosomiasis. Many cestodes and trematodes are susceptible to it. It acts by inducing tegmental damage and increased calcium influx in the parasite, causing spastic paralysis and death of the parasite. Praziquantel shows extensive hepatic first-pass effect. Its intestinal absorption is better with high-carbohydrate meal. The cerebrospinal fluid concentrations reach up to 20% of that in plasma. The adverse effects are generally mild and transient, commonly GI upset, dizziness, and lassitude. Like many other anthelmintics, there may be flu-like syndrome, rash, eosinophilia when treating heavy infestations due to release of antigens from dying worms. Ocular cysticercosis is a contraindication due to excessive tissue reaction and damage for the same reason. Although glucocorticoids can limit itch reactions but are avoided because their concomitant use would reduce plasma levels of praziquantel. Rarely, meningism or convulsions have been reported. Niclosamide is the alternate choice to praziquantel for T. saginata, D. latum, H. nana and most other cestodes, primarily in GI infestations only. It acts by blocking oxidative phosphorylation of ADP in parasite mitochondria, or stimulates ATPase activity. Given orally, it is chewed with sour fruit juices to increase mucus production, as mucus-trapped organisms show better response, especially H. nana. The adverse effects include mild GI upset with or without purging. In T. solium infestation, there is a perceived risk of cysticercosis secondary to therapy. Theoretically, the drug-damaged gravid worm can release ova which may develop into larvae and cause cysticercosis. Triclobendazole is an unusual benzimidazole as it has no action on nematodes, unlike those mentioned earlier. Its mechanism of action is similar to other benzimidazoles, but here the target is in flukes rather than in nematodes. It is used to treat fascioliasis or paragoniomyces. Though generally well tolerated, it may cause GI upset, headache, sweating, biliary obstruction and quart interval prolongation. Oxamniquine is an alternate choice to praziquantel for S. mansoni and acts by ATP-dependent activation and generation of alkylating moiety that may damage parasite DNA. It should be given empty stomach. The adverse effects are many. The neurological symptoms are most common, such as dizziness and headache. Also, nausea, vomiting, colic and pruritic. Sometimes it may cause seizures, orange-red urine, hematuria, and leukopenia. Metrophenate is an organophosphate that acts by cholinesterase inhibition in the parasite. This leads to depolarization blockade at neuromuscular junction and paralysis. The parasite would no longer be able to hold on to the site of attachment in the host and would be expelled out. It is used in schistosoma hematobium infection. It is a prodrug that non-enzymatically changes into dichlorovos. It is eliminated completely within 48 hours. The adverse effects include transient cholinergic symptoms, such as vertigo, lassitude, nausea, colic, sweating and bronchospasm. It is contraindicated in pregnancy, and in people with recent exposure to insecticides or concomitant use of succinylcholine. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!